welcome back to Simply Women's Health with CJ. Today I want to talk about planned or scheduled cesarean sections, why you might need one, and what to expect on the day of your surgery. If you stick around till the end of the video, I'll give you some questions that you can ask your provider that might help alleviate some of your anxiety. There are a number of legitimate reasons that cesarean might be recommended. The majority of these are for the safety of you or your baby. What are some of these reasons? Your baby may not be coming down in the head down or vertex position. He or she may be breech or in a transverse or side to side lie. If you have a history of 2 or more cesareans. If you have an infection such as herpes or HIV. If you have something blocking your cervix. You might have a large fibroid in the bottom part of your uterus or placenta previa. Placenta previa is when the placenta grows on top of the cervix, blocking the exit. If you have long-term health concerns that involve either your heart or your brain and it would be unsafe to push a baby out, cesarean may be recommended. The final reason is maternal request. There are some patients who, for whatever reason, do not wish to labor. They request cesarean birth. Keep in mind, cesareans are not without risk. Infection, bleeding, pain. You could have damage to adjacent organs. Some babies have a hard time breathing after a cesarean birth. Most cesareans are scheduled in the 39th week, unless you have a reason to be delivered earlier than that. You have hypertension, your baby's not growing properly. These are reasons your provider may recommend they do your C-section a little bit earlier than 39 weeks. The day prior to surgery, your provider will probably instruct you to take a shower and cleanse yourself with antibacterial soap. Please do not shave or wax your bikini line. That can increase your risk for infection. They will most likely tell you you can't have anything to eat or drink after midnight. You can brush your teeth in the morning. Please do not take any medications unless you've specifically been instructed by your provider to do so. When you come to the hospital, I recommend you leave your suitcases in the car. Your partner can go get those once you've been transferred to postpartum. Upon admission, you're probably going to sign some consents. Your nurse at this point may shave your bikini line. She will be using an antiseptic soap. You will probably also be given an antacid to settle your tummy. Prior to surgery, your OB will probably come in and talk to you, as will the anesthesiologist. Once the team is in place, they'll take you into the operating room. Your anesthesiologist will place a spinal, that's basically a shot that goes into your back. It will numb you from the breasts down. They're going to lay you back. They're going to put a catheter into your bladder to keep it empty. At this point, they're going to scrub your belly, and then they're going to put some drapes on. They're going to make an incision. Your provider is going to deliver the baby. Usually it's no more than 15 minutes from the time you get your anesthesia till the baby comes out, so the baby is exposed to an absolute minimum amount of medication. After the baby is out, he or she will be taken over to the warmer and the pediatrician will check the baby over. If you are planning on having your tubes tied or removed, now is when that will go down. After they finish the procedure, get all the stitches done, they're going to put everything back together, put a bandage on your belly. They're going to move you into the recovery room. You'll be in recovery for a couple of hours. They'll be doing vital signs frequently. They'll be pressing on your belly, checking your bleeding. After you are fully recovered, you, your baby, and your partner will probably be transferred to the postpartum unit at that point. So, what are some questions that you should ask your provider? Number 1, how long do you anticipate me being in the hospital? For some people, it's just a couple of days. Some people will stay as long as 4 days. Good thing to ask so that you know how much to pack in your suitcase. Number 2, how soon can I breastfeed my baby after surgery? Number 3, what is the plan for pain management, both while I'm in the hospital and once I get home? Number 4, will I be able to have a vaginal birth in the future? If there's anything that I can help you with, any questions I can answer, please drop them in the comment section below. While you're in that comment section, I would really appreciate it if you'd hit that like button.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.